Hello, my name is Ben Rossavik. Thank you so much for taking the time to listen to our presentation at this year's OSU CHS Research Week 2022. I'll be talking to you today about respiratory comorbidities seen in patients hospitalized with COVID-19. We conducted this study in the first 6 months of the COVID-19 pandemic during my time as a resident at OSU, and I've been fortunate enough to put this information together now for presentation at this year's Research Week. I worked on this project and research with multiple physicians at different specialties, as listed here. As you can see, I myself am a pediatrician, but we also worked with allergists, immunologists, and we also had OBGYN as well involved in this study for review. I've left my contact information here on the first slide if any of you have questions that you'd like to reach out to me after the presentation. As for our background, severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2, is responsible for the coronavirus disease 2019 pandemic, or COVID-19 as we all know it. It is an airborne respiratory infection with multisystemic involvement, notably in the upper and lower airways. People of any age with certain conditions have been demonstrated to get more severely ill with COVID-19, but as many of us know, this affects people of all backgrounds as well. The objective of this particular study was to assess the respiratory comorbidities of patients who were diagnosed and treated with COVID-19 at our tertiary center to see which chronic respiratory comorbidities were most prevalent at admission. This included all patients that were hospitalized, which is why we wanted to have a few specialists and physicians of different backgrounds. As for our methods, an IRB-approved retrospective chart review was performed of all patients who were hospitalized and discharged with COVID-19 from our tertiary center within the first 6 months of the COVID-19 pandemic. Our institution's electronic medical record was accessed, and a list was generated of COVID-19 patients diagnosed at our facility. Patient data was collected for those who were admitted at any time from March 2020 during the start of the pandemic to August 2020. Problem lists and medical histories were reviewed for respiratory-specific comorbidities present at admission. Findings were reviewed by individuals of multiple specialty backgrounds, including pediatrics, internal medicine, allergy and immunology, and obstetrics and gynecology. Within allergy and immunology, you can obtain that training by starting with pediatrics or internal medicine first, which is how we were able to get the internal medicine component of our multi-specialty backgrounds. As for the results of our study, a list of 232 patients was generated with a median age of 66 years old. 30.2% had a respiratory diagnosis listed in their problem list or past medical history. Overall, chronic obstructive pulmonary disease was the most common condition seen in our patients' population of COVID-19. Asthma and wheezing was the second most common at 10.8%, and allergies, seasonal allergies, allergic rhinitis was the third most common at 6.5%. As for our conclusions, 30.2% of our COVID-19 patient population had respiratory comorbidities or histories at diagnosis. Some degree of underlying respiratory disease may play a role in the development of COVID-19, but more definitive correlation with the disease severity remains to be seen. As you can see here are a few references that we used with gathering some information about the background of our study. And just for everyone here, I went ahead and included an expanded results section of the specific comorbidities that we saw within our patients. Thank you so much for listening to our presentation, and if you have any questions, don't hesitate to reach out.